So it looks like everything is in order.
To the December edition of the Public Health Virtual Journal Club. My name is Danielle Tremblay, and I'm CPHA's Communication Manager, and I'll be your host today. I would like to start by acknowledging that while we're all coming to this webinar from different parts of Turtle Island, CPHA's offices and my home are located in Ottawa, which are the ancestral unceded territory of the Algonquin Anishinaabe Nation. CPHA is committed to meaningful truth and reconciliation with all First Nations, Métis, and Inuit peoples, and to that end has established an Indigenous Advisory Council to guide its path towards reconciliation. A few housekeeping notes before we begin. If you would like to ask a question, please do so by using the Q&A module and not the chat feature, please. We're recording today's webinar and it will be available on our YouTube channel. All participants will receive an email containing a link to the recording once it's available. Usually takes a few days for it to turn around. So it's now my pleasure to introduce Monica Imode, the student member of CPHA's Board of Directors, who will moderate today's session. Over to you, Monica.
Thank you, Danielle. So just to kind of go, and thank you everyone for being here today. I know it's December and you guys are eager probably to get your holiday season started. As Danielle mentioned, at CPHA, one key area of our work is to advocate for public health, speaking up for people and populations to all levels of government. We champion health equity, social justice, and evidence-informed decision-making. We are a catalyst for change that improves health and well-being for all, and our vision is a healthy and just world, and our mission is to enhance the health of people in Canada and to contribute to a healthier and equitable world. And we encourage you to follow along the conversation on Twitter, and we've included CPHA's handle for Twitter and Facebook here as well. And so the Canadian Journal of Public Health is an independent journal that publishes peer-reviewed original research and scholarly articles submitted in either English or French that are relevant to population and public health. So the journal aims to advance public health research practice in Canada and around the world, contributing to the improvement of health and populations and reduction of health inequities. And you can find the handle for Twitter on here, CJPH_RCSP. And so for the past 4 years, we've been holding a webinar series to engage our members. So initially, this series was primarily intended for students, trainees, and early career professionals with the goal of promoting public health careers. So you can find the recordings of all these previous sessions on our YouTube channel. And this year, we are holding a series in partnership with the peer-reviewed journal that we publish, the Canadian Journal of Public Health. Each month, a graduate student will critically appraise a different journal article and will engage the paper's author in discussion. A committee of devoted volunteers have identified the first 4 papers, and registration for webinars will open a month prior to them taking place. And so there will be 4 more webinars coming in the new year. And so our hope is that this journal club series will provide a supportive learning environment for the participants to keep abreast of the current public health literature, develop skills and competencies in critical appraisal, and expose participants to a range of methodologies and analytical approaches used in public health research. We hope that you find these sessions to be invaluable, and we encourage you to follow along the conversation on Twitter using the hashtag CJPH_JClub. And I'm looking forward to another exciting webinar presentation and a thoughtful discussion. But before we get just a little bit of housekeeping. So as Danielle mentioned, all participants are muted, and so we hope to engage you throughout the webinar through polls and other features. And so you'll see a toolbar at the bottom of your screen that has a few features. So if you have general comments, you can post those in the chat box, but we encourage you, and we also encourage you to chat amongst yourself within the chat as well. And if you have questions for the presenters, they'll be seen through the Q&A box, so we encourage you to post them there. And just a reminder that the webinar is being recorded, and so the recording will be available to all members following today's session, and slides of recordings will be available more broadly to the public in 3 months. And so this is my very exciting part. I get to learn a little bit more about who's in the audience today. And so I ask you to fill out some of these polls. And the first one, where are you at in your current studies or career? So it seems like we have a a very mixed audience today. So lots of early career professionals, but also lots of graduate students as well. So welcome. And where are you participating from today? I'm very impressed to see our turnout from Prairies and also the Atlantic. We had one person in our initial webinar, and now we have 2 people from there, so that's a good turnout. And I'm very impressed to see people from Alberta, Saskatchewan, and Manitoba. And the final question, what is your primary area of focus? So lots of people in research and some people in policy as well. Excellent. So without further ado, it's my distinct pleasure to announce today's speakers. We have the privilege of not having only 1, but 2 authors present today at today's session. But our presenter today will be Maame De-Heer, who recently completed her master's in public health at the University of Toronto. She's a policy analyst with the Mental Health for Black Canadians initiative at the Government of Canada and a clinical research analyst with the Toronto General Hospital. In addition to these roles, she's also founder of the Power of Love Foundation Canada. Our first author, Dr. Greta Bauer, is a professor in the Department of Epidemiology and Biostatistics in the Schulich School of Medicine and Dentistry at Western University. She holds a CPHA Sex and Gender Science Chair. She came to Western in 2005 after completing her PhD and MPH at the University of Minnesota School of Public Health. And her primary research interests are in social marginalization in health and quantitative research methodology for studying communications that experience marginalization. Our second author is Mayuri Mahendran, who completed her Master of Science in Epidemiology and Biostatistics at Western University earlier this year. Under the supervision of Dr. Greta Bauer, she is currently working as a research associate with Dr. Bauer on projects related to assessing and applying quantitative methods for intersectionality research. And so without further ado, I'll pass this along to Maame to begin her presentation.
Thank you very much, Monica, for that amazing introduction. If you permit me, I would love to share my screen. Give me 1 second on this.
I think you should be able to do it.
It's not showing me my PowerPoint screen. Interesting. Just give me 1 minute where I'm going to save this, and then, if possible, Monica, you could talk whilst I figure this out.
It's hard because I know the panelists, I can't hear the panelist. Or I can't hear the audience, I meant.
Okay, there we go. Is it visible now?
Yes.
Wonderful. Give me just a second here. 1 second. Just trying to adjust this. Perfect. Okay, so thank you for that excellent introduction, Monica, and thank you everyone for joining us today. As Monica had said earlier on, and as my other fellow members of CPHA had stated, I know it's December, it's been a quite tough year, but just taking the time to join us today, we're extremely elated for that. So today's discussion is going to center on identifying visible minorities or racialized persons on surveys. Can we just ask? And I'm very honored to be presenting this research together with the 2 authors, Dr. Greta Bauer and Mayuri Mahendran. So they are the primary authors of this paper, and I'm extremely elated to be here presenting their research. I just wanted to also highlight that with the interest of time, considering that the presentation would have to be in a maximum of 15 minutes, I would primarily be focusing on the methods section of this paper. However, nonetheless, I will also be providing a synopsis of the research and how the paper basically turned around in terms of the objectives, the results, and the conclusions prior to delving into the methods section. So let's begin. So as stated earlier on, this paper is authored by Dr. Bauer et al., and it seeks to understand how Canadians from diverse backgrounds tend to understand the terms of person of color and visible minority. It also seeks to highlight the construct of racialization when it comes to public health and how individuals perceive, individual self-perception tends to affect your experience and what your experiences when completing question-based surveys. Now, the main two reasons or two categories, I should say, or the reason why person of color and visible minorities were selected because when it comes to assessing these I should say codes such as visible minority and people of color, these two main themes tend to be items that affect racialized communities because they tend to reduce inequalities that result from perception on race or ethnicity or anything that has to do with the concept of racialization. So as a result, with this information that was ideally retrieved from the paper, the authors were able to assess the extent to which the responses from participants were used for single item survey questions that were based on the terms that tend to agree with each other, or and with the Statistics Canada standards that classify visible minorities. So simply put, and in layman's terms, the researchers just aim to assess whether single survey items would be useful to study racialization and how this information retrieved from participants in turn tends to impact the health of racialized populations and people who are not of color as well. And they ideally did this by comparing the Statistics Canada standard for visible minority classifications with two single item measures, whereby the first question questioned whether one is a member of a visible minority group, and the other question tend to inquire if one is perceived or treated as a person of color. So ideally, this research that the authors underwent is extremely expedient for two primary reasons. One being that in the country where we happen to be in right now in Canada, ethno-racial categories tend to form something called a key equity stratifier. And this is basically used to identify certain population subgroups that have numeric inequalities when it comes to their health, when it comes to social determinants of health and healthcare in general. And these factors are very expedient since they can be used to indicate social inequity. In addition to this, ethno-racial classifications are very important because they are used as key indicators when it comes to figuring out concepts and constructs of racialization, which can in turn be impacted by have an impact on racism, or can be impacted by racism that tends to perpetuate our communities. So due to the particular groups that are being, some of the groups that are being prejudiced or discriminated within the social construct of skin color, ethnic groups, to mention but a few, they are more likely to have diverse forms of inequality and inequity when it comes to healthcare treatment. And as a result, these experiences normally tends to stem from healthcare disparities such as poverty, employment issues, and even access to healthcare services. So subsequently, to study these inequalities and some of the effect of racialization, survey measures were the ideal requirements that were stated in this paper. And these survey measures, were sort of fixated on diverse categories when it came to visible minorities and people of color, because ideally the idea and the intent was to identify especially the intent of identifying visible minorities was mainly to assess and reduce the inequalities that sort of result from issues that stem from race or ethnicity and racialization. And also some of the ethno-racial categories in terms of surveys were based primarily on these factors that were centered on race and ethnicities. And as we can see here, some of the ethno-racial categories that were taken into perspective during this research were the ones that are listed on the slide. And those that were noted as visible minorities, some of them were also listed here, and based on the different groups of what people ideally chose to select when they were provided with the survey. So ideally, participants were asked, what do you identify as? And within this list, they had the responsibility or the option of selecting which of the visible minorities they believe they fall in. Moving on, being the main focus of this presentation, the primary methods that was used for this research was cross-sectional mixed methods data, and this data was collected between October 2015 and March 2016. The participants basically had to reside in Canada, and they were, the age group was participants that were over the age of 14. And normally this range, I should say, average group was of age group was chosen because when you look at most of the data that focused on adolescents that came from Statistics Canada, most of these teens or adolescents were also questioned on things that were in relation to their race. So this would have been an ideal age group. In addition to that, the participants had to be fluent when it came to English, and they had to be able to complete an online English language survey. The primary sampling methods that we used were convenience sampling, and convenience sampling tends to target specific groups, which include immigrants, gender, sexual minorities, and these were the primary groups of people that were included in the survey. In addition to that, the recruitment strategy for this study primarily focused on the use of Facebook ads, Facebook postings, emails and listservs, service organization, electronic snowball sampling, and these were the main methods that were ideally feasible for collecting the data. Now, based on, after all the data was collected or collated, they had approximately 588 completed English language surveys, whereby 311 participants consented to be recontacted and have a follow-up. However, when everything was finalized and after the 3 weeks of following up, the research ended up having approximately 79 participants. Now, the potential interviewees were selected to ensure that there was an adequate representation, ideally of certain demographic and factors such as age, sexual orientation, gender identity, geography, immigration, race and ethnicity, education, religion, to mention but a few. And the main form of which participants were interviewed were via telephone, through Skype. Now the information that was retrieved was transcribed verbatim, and the interview process lasted for a maximum of 81 minutes and a minimum of 24 minutes. Now, the 3 survey measures that were ideally used for this research were broken down into 3 different categories. The first one being visible minority, that took into consideration visible minorities, Aboriginal groups, as well, or Indigenous groups, as well as population group questions. The second survey measures focus on the single question and the direct single item that was posed to these participants, which was, are you perceived or treated as a person of color? And the final survey measure was a test question that just simply asked the participants, are you a member of a visible minority group? Moving forward, this was a sample, or I should say, just a screenshot of some of the survey items that were available to participants. Moving on with the methods, the participants actually self-reported their age, their first language, and other factors that were formally listed. The mixed methods analysis was the ideal approach that was used in this research, whereby the quantitative analysis was analyzed using SAS, and NVivo software was used to analyze the qualitative aspect of this research. The interview transcripts as well had individual interpretations of diverse terms, questions, as well as response options. And inductive approach, which is normally used when it comes to qualitative analysis, was the ideal approach that was used for this research, and it prioritized participants' understanding and experiences, especially when it comes to the aspects of race as well as ethnicity. Moving on, the responses that were formulated, or I should say acquired from the surveys, were sort of tabulated with Cohen-Kappa's idea, I should say, agreement when it comes to the use of survey. And basically, Cohen's ideology is that it indicates that normally probability, beyond chance, and two measures tend to classify a given individual into a similar group. In addition to this, a variety of discordant cells, which included, I should say, social demographics, were included when it came to certain discordant cells. And this was highly beneficial because it helped to understand the experiences that were shared by participants, especially when it came to race and ethnicity and the diverse traits that were prevalent. Now, the members also had interview transcripts that were analyzed based on terminology and diverse measures that better informed the survey response questions. Just to give us a better understanding of how all this information, the methods, and even the objective of the paper turned out to be, these are the results that basically came out. With the interest of time, I will not go into details on how each demographic or each location scored, but as we can see here, there were approximately 311 survey participants. However, when it came to the interview of interviewing approximately 79 participants, we realized that during the cognitive interview participants, they were more evenly distributed when it came to diverse social demographics categories. And these were the results that were basically presented in the paper. Now, to put the results into context, we can see that it was in the paper, it was basically separated into different categories that aligns with the objective of the paper. So first and foremost, in terms of general understandings of single questionnaire items, participants found that the person of color question was actually quite clear in comparison to the questions that they were asked on visible minorities. And they found that the question on visible minorities was quite confusing. Most participants understood both the concept of person of color and visible minority measure, especially when it came to race and ethnicity. And individuals who identified themselves as white only or Black only found both the visible minority question and the person of color questions to be quite easy to answer. And other participants, such as racialized as non-white, found these questions or these questionnaire items to be ideally quite difficult and challenging to answer. Now, the ethno-racial background that one may tend to capture when it comes to the diverse groups had a target when it came to the Statistics Canada standards. And the authors realized that when it came to Indigenous participants who reported to be persons of color, what happened was that they were reclassified to reflect the government standard or the government definition of visible minorities and as non-Indigenous. And this measure was quite described as the authors as a strong agreement when it comes to the current federal standard of measure. Moving forward, the self-reported visible minorities, we realized that they were not, the self-reported visible minorities who were not they did not align with the standard that Statistics Canada had when it came to their definition of visible minorities. Also, these participants used their own experiences of gender and sexual orientation to decide whether they classified as visible minorities. So in moving forward to that too, white sexual and gender minority participants noted that the importance of concepts when it comes to they noted that it was quite important to take into consideration the concept when deciding or interpreting the visible minority question. And in all, Statistics Canada, visible minorities who were not self-reported as visible minorities came down to 8 participants, and they were more so classified under the Statistics Canada self-reported category, and they were not part of this visible minority group. And just to sort of reiterate and flesh it out, especially with the self-reported visible minorities, people, or I should say some of the participants, considered that their sexual orientation played an ideal and imperative role in deciding or in defining themselves as visible minorities, because they believe that when they find themselves in diverse groups, they are the most minority amongst diverse groups. However, this might be reflected in different aspects, obviously depending on the populations or groups they might find themselves in, especially when answering certain single questionnaire items. So in conclusion, the authors believe that a single questionnaire, a single question on perception or treatment, especially when it comes to a person of color, seems to be the ideal way to identify racialized persons. And also, they do not recommend using a single self-reported visible minority item. What might be useful, ideally, is using the person of color item. They also recommend that it's expedient to just ask a single question where it could be, are you perceived or treated as a person of color? And this method is beneficial because it provides a more simpler way to better measure racialization, especially when racialization, race, and ethnicity is the primary construct of interest. The other suggestions that were also made by the authors was that single items could be used alone or with existing Statistics Canada thoughts, especially when it comes to Aboriginal groups, Indigenous groups, and population group questions. And lastly, the authors believe that it was quite imperative to just ask, as simple as being clear and asking the question when it comes to racialization and race and ethnicity was quite imperative. So thank you very much once again for listening to this presentation. My name is Maame De-Heer.
Thank you so much, Maame. That's a wonderful presentation. I'm just going to remind everyone that if you have any questions about the paper or for the panel, any panelists, to send them through the Q&A box, and we'll answer those. And then I just want to extend the opportunity for Maame to ask any questions she might have for Dr. Bauer or Mary.
I think I'll start first with my question and then we can open it up to everyone. So thank you very much, Dr. Bauer and Mayuri, and to the rest of your team for putting together such a very imperative and important study. I really enjoyed it whilst reading it because, especially during this period, I think this is a very, very useful paper. I was just curious to know what inspired your team to write such a very strong paper.
Maybe Mary can jump in and talk to the strength, but I can give the background on where this came from. And first, let me just say thank you, everybody, for sharing part of your afternoon with us today and for being here to talk about this. This question, the perceived or treated as person of color question, is one that I wrote years ago, and it comes out of doing community-based research and working on a survey called TransPulse, which we now call TransPulse Ontario because it's grown into a national study since then. And we're really focusing on the impacts of social exclusion. And, you know, working with trans and non-binary communities, one thing that we decided we needed to ask was, how often do people know you're trans without being told? It was really important, not just how people identified, but how other people perceive them, because that affects targetability. It affects the types of harassment and potentially violence that might be directed at somebody, or the microaggressions on a day-to-day kind of basis. And then when we got to the questions around race and ethnicity, we were using these Statistics Canada questions, and they don't, as many of you know, they don't resonate with people in community in the same way. There's no way to be brown without being from somewhere. The categories might not fit people exactly. There's a lot of ways that people don't see themselves in those questions. And when we started to talk about racialization or targetability or what that would mean, there's not a really clear match between these these ones. So for example, the fact that Indigenous people aren't included in visible minority, and some Indigenous people can be perceived or read very differently by other people with regard to their racial and ethnic background. So I wrote this one question: are you perceived or treated as a person of color? And then people liked it. And then my colleagues used it in other studies. And then the community teams in those studies decided they'd rather categorize people by this than by the StatsCan measure. And then we came back and used it again, and we've changed it a bit over the years. Like in the current iteration, we've added the words in Canada. I think people all interpret it as in Canada, but just to make clear that we're talking about how you're treated in a Canadian context for people who've lived or who work in different contexts. And, you know, in one of my more recent projects, we use it in combination with a question identifying as a person of color. And we categorize that racialized group as anybody who identifies that as or is perceived or treated as. But these are different things. And for me, for a lot of my work has focused, the measurement part is focused on multidimensionality. And in this regard, it comes from critical race theory, it comes from measurement work in epidemiology, it comes from different areas. And just the idea that identity is not the same thing as other people's perception of you, is not the same thing as experiences of racism, is not the same thing as community membership, is not the same thing as culture or other potential ethno-racially associated variables like diet or behavioral things. These are all different things. And as epidemiologists, we can measure all of those, and we can measure all of those separately. And so we were really interested in kind of capturing this other dimension. And so then the research question became, after using it a number of times, is do people understand this like we think they do? And how does it compare to the StatsCan measure? Because it's not that people will necessarily want to replace it with that, but if we're comparing our results to results from studies that use the Statistics Canada measure, we do need to know whether we're comparing apples to apples or apples to tangerines, right? You know, so how similar is it? Mary, do you have anything to add on the more recent part of what made the paper strong?
I did notice someone did have a question in the chat asking what the original StatsCan question was. So regarding that, the StatsCan question, it lists multiple different checkboxes that you can say. So you can say, yes, I'm South Asian. If you're of mixed origins, you can say, yes, I'm, you know, maybe white and Chinese. And then the way that StatsCan then turns that into a visible minority measure is that if you select certain boxes, or if it is white mixed with certain other categories, then you're counted as a visible minority. And one of the strengths from our paper that we found is that I think especially that Stats Canada visible minority measure, it's kind of built for like a different conceptualization of race, where you don't think about people who are mixed or what that means in terms of how they are perceived or how they experience maybe culture in their own homes versus how they are racialized outside the home. And so our paper really got to touch on the fact that that measure can be faulty both ways. So it can say someone might be racialized when they're actually not, because maybe just the way that they look, people don't identify them as racialized, but it can also be the other way. So the StatsCan measure, for example, assumes that if you have, I think, Middle Eastern origins, and you also say you have a white background, they say that you're not a visible minority. But someone might say, I actually am perceived as racialized and I've had racialization experiences, and those things are lost. So we were able, because we had that mixed methods approach, we were able to actually have people explain that they experienced those racializations. And so even though they're not classified as a visible minority, they still feel like they are.
And just to kind of follow up what you said, Mary, so you talk, and also Mame's presentation, so you talk about using a mixed methods approach. And I'm curious, for some people in the audience who might be curious about learning more about the methods. So I guess I want to focus on both qualitative and both the qualitative, a question for both of you. The first, I guess, so you mentioned that qualitative analysis is guided by an inductive approach. And so for those unfamiliar with qualitative analysis, can you explain a little bit about what this is, how that approach informed your coding process?
Well, neither of us actually did the coding on this, so that's important to know. That was Jessica Bramo, our co-author, who's brilliant with qualitative research. But I think we can probably both talk to it, right? Yeah, so I think that the starting point was to stay very close to the participants' experience and to build up the coding from there. So, you know, we say that we started out with a parallel analysis, And then we had kind of an iterative process. And what that looked like is we were doing the quantitative analysis, which I was doing. And then Jessica was working on the qualitative analysis first. And so without going between those, I was doing those sensitivities and specificities, looking at agreement. And she was staying really close to the participants' wording and trying to not make assumptions. Whereas in the second part of the analysis, we were looking at those discordant groups and going back to the participants' words with that framework from the quantitative work to say, okay, are there things here where they're explaining the discordance? And so those are really different approaches, but the initial coding was very much like, what are they talking about? What's the language that they're using? Because they were cognitive interviews. So the whole point of the interview was to understand their thinking process. So we didn't want to come at that with a lot of assumptions or some schematic, scheme that we developed in advance. We wanted to see, the specifics of their thinking. And then Mayor, you were really involved in like the discordancy part.
Mm-hmm. Yeah, for the discordancy part, it was a little different, I think, because the number of participants in the quantitative section was 311, but we only had cognitive interviews for a select number of those people, so I think only 79 participants. So for some of our discordant groups, we only had maybe a couple of people who we actually had cognitive interviews from. So there wasn't too much of like a decision-making process in terms of who to include or exclude in terms of like what quotes they had. It was whoever's information we could get was all included in there as well for to explain those discordancies. So some of them we still didn't really get to answer, which is a bit of a shame, but there was still a lot of good information we got out of those as well.
And in your paper, so you also mentioned that you used the Cohen's kappa, the chance corrective agreement. And so for those in the audience that may not be familiar with this, can you explain a little bit what this is and why you chose this measure over other particular correlation methods, as well as how you determined what constitutes an acceptable limits of agreement within your study?
Sure. So I think it's not a very involved analysis on this. And we were interested in how they agreed because we know that some people had asked, colleagues had asked, we just have this one question, just replace this other question. So that was a question. I kind of consider them different things that you might want to ask both of. But if you chose to just ask a single question, you would also want to know to what extent does that agree with the measures that are used in other people's research. And so Cohen's kappa corrects for chance in the sense that if people just randomly answered the questions, there would still be some level of agreement. So it removes that from the measure, so that that if there was just a random level of agreement, that would be 0, and perfect agreement would still be 1. And so it adjusts for that. So you can see the overall agreement, but it doesn't really tell you the nature of that agreement, like who disagreed and who agreed, which is why we also used sensitivity and specificity. So that was using the StatsCan visible minority category as the gold standard, not because it's a perfect measure of anything, but just because that's the thing to which people were likely to be comparing their results because it's used in so many studies. And so sensitivity then would say, does this question, what proportion of StatsCan visible minorities are captured by this other question? And specificity would be what proportion of StatsCan non-visible minorities are correctly identified by this question. And so the good, that's pretty arbitrary, what's good, what's really good. So I think the key point is probably that it's not perfect agreement. If you really want to be able to compare it to the Statistics Canada, you should probably ask that so you can compare directly and know that you're measuring the same thing. But if what you want is a simple single question that people generally seem okay answering, are you perceived or treated as a person of color, does a lot of work and probably better captures racialization. So the Indigenous people, for example, who aren't counted as visible minorities, the one who said that they were perceived or treated as a person of color, they identified that based on their skin color, based on racialized experiences, and they don't get included in that. And so if you want that experience of racialization, you don't want to exclude Indigenous people just because the visible minority is categorized under the Employment Equity Act. And a lot of what we're doing in health research, public health research, is not about Employment Equity Act, right? That's not the framework that we're bringing to it.
Mm-hmm. And no, that's really interesting. And the reason I asked that question is because you're right, there really is no uniform way to think about what constitutes acceptable limits of agreement. And I think sometimes when we read papers, I think you have to when you read papers as as a reader, and then you have writing, it's nice to know where people are those statisticians are about to make those decisions. And so that's very helpful. So thanks for clarifying that. We have a follow-up question from the audience. So considering the authors used a convenient sample approach, how appropriate is it to calculate kappa, statistic, and generalize from there?
Do you want that one, Mary, or do you want me to take it?
You want to start?
It's an exploratory study in a sense. We wanted a general idea of how it was functioning. I wouldn't say that we should generalize that to that's the level of agreement we're going to see in the Canadian population. You know, we tried to get, our goal really with the sample was to get as diverse of a group as possible to make sure, because this wasn't just about evaluating these measures, we were also evaluating measures around sex and gender and sexual orientation in the same study. So like a range of equity stratifier type of questions. So we wanted to make sure with those smaller groups, we had enough to analyze. We wanted to make sure we had people from different language backgrounds because, you know, people's interpretation of English language questions is going to be different depending on their linguistic background. So we were more concerned about that in terms of sampling than we were about having it be representative.
And Mary, did you have anything to add?
I mean, I was just going to say that I think because one of our highest discordant groups was with the visible minority measure, and maybe people who are sexual or gender minorities saying that they felt like visible minorities. And so that was the main source of discordance. And because we did have a higher percentage of those people in our sample, that maybe that would make the visible minority measure seem or the single item question seem like it's more in disagreement with the StatsCan measure. But I would also say that there's other ways that maybe it could go the other way too, like the fact that we didn't have a lot of non-English speakers or people who were much older, for example, in our sample, who could maybe switch things around the other way. So.
And another question from the audience. So do you think that new measures or single questions could capture intersectionality in different ways? So for example, combining racialization and gender experiences into a single item or a few questions. And are you doing any work in this area currently?
Into a single question. All of the intersectional measures that I know that are trying to capture experience at a particular intersection are really focused more on processes like discrimination and the ways that, for example, racialized sexual minority people might experience discrimination in very particular ways. And those aren't single question because they're scales. So I'm not sure how you would capture particular intersections in terms of these kind of stratifier questions, unless you asked, are you A and B and C? And those kind of questions are often generally captured better in single barrel questions that are asking one thing at a time. But I'd be interested in hearing people's ideas. We're continuing to work, Mary and I both are continuing to work on methods and incorporating intersectionality into quantitative work, but that's not an area that we're working in right now.
And I want to pause here and just ask if Maame has any additional questions that she wants to add. Oh, you're on mute.
Yeah, I realized. I was going to say, I think I'm enjoying all the questions everyone is bringing in, but I think the only thing I would like to inquire, which I'm sure many have asked, is in terms of the current crisis we have, especially in Canada, which is lack of effective race-based data. How do you think that this research helps to bridge the gap with that?
You want to go first? Okay.
Or was just to the pause where we wait to see who wants to.
I definitely think this measure should ideally, I think, be used in combination with other measures as well of race and ethnicity, especially if you're collecting larger data sets. And you might be able to stratify later based on smaller groups of race and ethnicity, because we don't want to flatten all, people of color into one group. But I think it's also useful, especially if people are like, I can't collect race ethnicity data, maybe because my sample is too small, or people won't want to respond because it's too identifying, this is a way that you can also then incorporate that into the data as well.
Yeah, that's a good point. I really like the idea of multidimensionality and promoting that, because I think finally people are talking about the importance of including race-based data, but they're not all very, haven't necessarily given it a lot of thought or read a lot of the really rich literature that's been written in this area. And so it's important to have that discussion of multidimensionality out there with regard to the different things that we're measuring, because I think sometimes people will assume this is a much simpler thing to ask about than it is, or that they can just write a question and it's going to perform the way they think it's going to perform. But I'm very excited to see these discussions happening about the importance of disaggregated data. In my own work, we're not necessarily using this alone either, because we use it in conjunction with the other question to separate out, for example, if we want to look at anti-Black racism in particular, we may want to have a larger group of racialized people who are identified in part using this question, but we want to also at least explore whether there are differences with regard to Black populations within a study and other racialized populations, if we think that anti-Black racism might be playing a role in an effect, for example. And we also want to be able to identify Indigenous people, not just based on racialization, but indigeneity, of course, is very much its own thing, and the history of colonialism creates a situation where the effects can be very, very different. And Indigenous sovereignty requires that we, respect those data and treat them potentially in a different way. And that's overlaps, but isn't simply a question of racialization. So I think it's really important to have enough data to have a nuanced approach to how we analyze and how we interpret our results.
Thank you. And so I have a follow-up question to that. So in your paper, so about 76% of survey respondents did not identify as a visible minority or perceive themselves as a person of color. And so I'm curious to know what your thoughts are in terms of how you think that this, if you think the inclusion of those people, as you discussed, like in terms of more generalized and having more data, whether or not that would, I guess, like how it influence results, and perhaps like, what do you think it may or may not change your recommendation on the addition of the question?
I missed one very important word early on. Percentage of who didn't identify as visible minority or person of color?
About 76%. Is that in your paper?
Of who? Of everybody?
Of survey respondents.
Okay. I think the way that the results are structured, so we know that a lot of those people had a pretty easy time with the questions. And so they weren't the focus of a lot of the discordancy analysis. And you see that a lot of the paper is really focused on that. And so, and we also, that was sort of the survey respondents, and then the selection into the interviews, you see, we show it in the table that the breakdown of those groups looks really different, because we wanted to make sure we had enough people from these different groups to get that detailed qualitative data from. I'm probably missing something there, Mary.
I was just gonna say, I mean, having, that large proportion who that was an easy question to answer meant that we didn't have a lot of qualitative data to draw on for the discordant cells. But in terms of reflecting the population, that's also sort of, we have to also have those people to make sure that it is an easy question for them, because for some people it actually wasn't, even if we thought it was. So it was also important to include them, not just people who we thought would say yes.
Yeah, one interesting thing that's not really in this paper, but that came out in doing the analysis for sex, gender, sexual orientation, and race ethnicity, is that the people who were members of groups that weren't that easily classified in one of those dimensions tended to have more concerns about the others, or more questions, or it wasn't as easy for them. So for example, people who were biracial, when asked about sexual orientation, even if they were heterosexual, had a lot more concerns about those measures. And similarly, the people who had a lot of concerns about these measures who weren't racialized were often sexual or gender minority people, or the people who didn't fit neatly into those categories or weren't members of majority groups. So that's just an interesting observation from across the multiple analyses as well.
Mm-hmm. And I think it speaks to importance too of having the mixed methods approach here, so because you can see that full spectrum of individuals, and I think that's really important. And then there's a question from the audience. So do you recommend a sequence of how to ask these questions in the survey? So for example, FNMI,
First Nations, Inuits, and Métis, I think.
Come first rather than race, then person of color, as the anti-racism data standards recommends a sequence of questions to ask.
So our research doesn't really answer that question, but I have thoughts on it. Do you want thoughts or do you want things related to this paper?
Yeah.
Yeah, I always ask indigeneity first because we're a colonial country. We're here on, indigenous lands, and I think out of respect and primacy of that in a situation like that, I always ask indigenous questions first. And then if I'm asking an open-ended question about how people identify, I always ask that before I ask people to categorize themselves. And I think it's a question of two things: getting them to think about it first and then classify, but also out of respect to acknowledge the fact that we ask these questions that are categorized and they often don't reflect the ways that people would prefer to talk about themselves as well. And so, and that's true if I ask about sexual orientation or gender and stuff as well. If I ask an open-ended question, that comes first, and then let's narrow it down for the kind of survey questions we need to put people in their respective boxes so that we can also have that flexibility. So I like to sequence kind of in that direction. In terms of then race and then person of color, I'm not quite as sure about that in terms of whether it might be better to ask whether you're perceived or treated as a person of color and then your ethno-racial background or vice versa. I don't know if other people have thoughts on the order of those or other thoughts that might be different than what I tend to do.
And I wanted to also, so another question was, why hasn't the Employment Equity Act of 1986 have been amended to account for a more accurate definition of visible minority? Maybe that's a difficult question to answer.
Not an expert in that. Is anybody here an expert in that area?
So I did want to ask, so I'm curious to know as to why you chose the Canadian Journal of Public Health. And I guess through the course of peer review, I guess kind of thinking about your thinking or the process of going through that as well for those who might be interested in publishing with CJPH.
Well, this was in the special issue that came out of the Canadian Society for Epidemiology and Biostatistics meeting. So it's one of those papers. But also it's a very Canadian question. Like visible minority is a Canadian government term, right? And how people understand these is specific to their context. How people are racialized is specific to their context. The language around these kind of questions is context specific. And in that regard, it would have been great if we could have done it in French at the same time as well, because I think it might come out differently in that regard. So for me, at least, those were the major considerations, that there was an opportunity based on the meeting we'd presented at, and it's where we were going to send it anyway. So that was kind of...
That's good to hear. And my final question, and so why do you think there are implications of asking someone? I know you work a lot with sex gender, and I think it's super interesting. And so I'm curious to know if you think there are implications of asking someone to identify as whether or not they're being perceived or treated as a person of color. So I understand the parts of it from a research perspective, but I'm just curious to know your thoughts on that.
Are there implications? Do you mean for the participants as they're filling out there's implications all along for things that we ask, right? How is a participant going to react to that, perceive it? What message are they getting from that question, through to how is that used in interpretation, and how is it applied at the end of research? I think in my experience doing community-based research, this is a question that people have generally liked. In multiple studies, that are heavily community-based, people have wanted to include this question and have wanted to use it in analysis. So I think that it resonates with people a bit. It's not perfectly going to capture, if we think about racialized, one group it's not perfectly going to capture, I think, are, there's some number of Asian people who are going to say, I don't identify as a person of color, perhaps, but definitely are going to say I'm not perceived or treated as a person of color. And you saw that in our study as well, right? Which is interesting in light of some conversations that are happening about the expansions of whiteness over the years and whether Asian people are being, captured in this larger group of whiteness as it's expanded over the years to include Southern Europeans and Jewish people and things like that. But it's a question that people have generally responded very positively to and have wanted to use. So that's good. Is it a perfect measure of what we call meta-perception or street race? I'm not sure about that, right? Mm-hmm. So to the extent that it's trying to capture how other people really perceive somebody, it's meta-perception. We're asking someone, how do you perceive that others perceive you? But research suggests that people have a pretty good idea about that, because we know when people are treating us, in a particular way. We know when people are perceiving us as something other than we understand ourselves to be. There's a pretty good perception around that. So I think there's a bit of a risk in conflating it with, but I think not a huge risk in conflating it with how other people actually perceive somebody. But that is a criticism. Mm-hmm. Mayuri, I'm just wondering if you have other thoughts on that, because there's so many different implications of.
Well, I mean, you did modify the question, right, to say identify as well. I guess you didn't get to see how that, we couldn't test if that would actually change those people's minds or not, but.
It's a different question. That's a different question, though. We asked that as a separate question and then just changed the coding to also include, yeah.
But I think it would be interesting if we could know if those people who in this study who said, no, I don't think I'm treated as a person of color, if you said identify, if that would, sort of switch their, how they would put that down as well.
Mm-hmm. And it's so interesting because I think sometimes those nuances, I mean, there really is no perfect measure. And I think sometimes those nuances are really important to think about. And I think it's very interesting. So we have quickly run out of time. So just in interest of time, I just wanted to share my screen. And so thank you so much for answering all our questions and all the questions from the audience. I'm not sure, can you guys see my screen?
We can.
Mm-hmm. So I just want to plug our next Journal Club session, which will be happening on January 27th. From 1 to 2 p.m. We will be discussing the paper With Great Inequality Comes Great Responsibility, the role of government spending on population health and the presence of changing income distributions. And as well as, just 1 second. And so if you are a CPHA member, you can register for free when you're logged into the CPHA member portal. And if you are a non-member, you'll be able to register from the webinar series page. As well, if you are not a CPHA member, we definitely encourage you to consider joining CPHA. So our membership is a great way to connect with the Canadian public health professionals, and there are many benefits to joining, including student opportunities, such as free access to our webinars, eligibility to participate in our mentorship program, and leadership roles. And if you're interested in becoming a member, I'm more than happy to sit down and have a one-on-one conversation with you about that. And I also want to thank you for attending today's session, and on behalf of CPHA, thank Greta and Mayuri and Maame for their wonderful presentations. And I wish you have a wonderful and happy, healthy holiday season.